introduce the dialysis machine. It's a key component of diabetes management. Unfortunately, far more common today. We're seeing diabetes as the leading cause of dialysis in developed countries, and it's one aspect of diabetes that people don't think about when they first are told they have high blood sugars. But this is what we're trying to stop you meeting. The high-tech equipment that keeps people alive is great stuff, but it does mean that you need to come into hospital at least 3 days a week. But you're hooked up to the machine for 5 hours, you need to be cannulated, and it certainly does put some limitations on your lifestyle. We're going to meet John's arm. John's kindly volunteered to donate his arm to let us see what being cannulated looks like, and we might even let him tell you what it feels like. Lance has kindly agreed to come and cannulate for the camera.
Oh, John, you've watched that, haven't you?
Yes, I have.
Essentially, blood's taken out of the connection between an artery and a vein in the arm, and that blood is then circulated through the machine. It's filtered, and certain chemicals are added to it to stop it from clotting. The blood is then purified in a way that the kidneys do, although the kidneys are much more efficient at it, and then the blood is returned from the machine into the body, doing the job of kidneys that can't work properly because they've been damaged by diabetes. Part of the business of preparing for cannulation is getting some local anaesthetic together, preparing some sterile connections, and some big needles. You need big needles so you get adequate blood flow going from the patient to the machine and back again. This is part of the business end of dialysis, and something that people with end-stage renal failure from diabetes and for other causes go through regularly every week.
A little bit of local anaesthetic, John. Right. Small sting. The other side.
So different pieces of plastic can be used to connect the artery and the vein and provide adequate flow. If you don't have an adequate flow, the machine can't process the blood efficiently, and there's a risk of clotting.
We just put a bit of saline and heparin in the line so it won't clot while we put in the second needle.
Costs of dialysis for the economy vary between country to country. It can be anything between $20,000 and $50,000 a year, depending on which country you live in. And it's one of the issues that impacts on the health budget, and one of the driving forces in trying to treat diabetes aggressively and trying to prevent those problems, other than trying to improve the lifestyle of people. Lance is just going to put the second camera in.
Alright, tell me if you can feel this. How's that, John?
Good.
Yeah? There we go.
The plastic's fairly tough, and that's why it looks like Lance is needing to use a fair bit of force to get through, but it's not hurting John because the skin was anaesthetised first, and the plastic bit doesn't have any pain fibre, so it's not hurting him.
We're all set. Feels alright?
Yeah, good.
That's great, thanks. Lance is just showing us that he's hooking up to the machine. You can see the various connections that are needed. The lines are primed with fluids to prevent clotting and allow the initiation of blood flow.
Okay, so first we get all that fluid out of the machine by priming the lines now with John's flow.
So they're the mechanics of how dialysis works, but for people who haven't thought about it, people with diabetes or people without diabetes, anyone with end-stage renal failure has to do this 3 days a week on average, and it has a very substantial impact on their lifestyle. They basically run their lives around the need to come to dialysis regularly. If they want to go on a holiday, then they have to arrange for a dialysis unit at a distant site to accept them into dialysis, and sometimes they may have to defer their holiday for some time until a bed becomes free in the satellite dialysis area. We're just going to ask John a few questions now about how he finds dialysis generally and what it means to him in terms of his lifestyle. John, what has going on to dialysis meant for you? In the first place, do you actually feel better because you're on it? What were things like before you went on dialysis?
Well, I was very seriously ill. Loss of everything just about in my body. All body functions were well down, and it's vastly improved with dialysis, of course. We start to become a bit normal in the way of living.
So there's no question that dialysis not only allowed you to continue to live longer, but you actually feel better for having had it.
Oh, yeah.
So it's not an option that you can do without once you get to that stage of kidney damage.
No option at all.
Apart from that, what sort of limitations have you found that the regularity of dialysis has put on your normal life?
Well, it's changed a lot of social activities, of course, with it. But you have to accept the fact that you can't do without it.
What sort of social activities did you enjoy previously?
Well, we travelled, done a lot of travelling, and of course this is now limited. It can be arranged, like people here do go on holidays, vacation, by arranging in another state or another capital place where dialysis is available.
Well, this is a town of about 80-odd thousand people, and we started this dialysis unit with 5 or 6 chairs. How many chairs do we have in the unit now?
12 now, yeah.
And that's in the space of about 4 years?
And there's a waiting list also.
Alright, so that people who can't be dialysed here have to travel an hour away, 5 days a week, to have their dialysis until such time as more beds become available here. And that's the rate of progression of renal failure within the community. And Lance might be able to tell us, the majority of the people dialysing here, they have, how many would you have with diabetes?
With diabetes, we have 24 patients in total, and probably about 10 of them are diabetics.
Okay, so it still doesn't represent the majority, but it's a fairly substantial proportion, and it's a growing proportion. How long have you had diabetes, John?
Since 1988 I was first diagnosed with it.
How old were you then?
I was 58.
And how did you find out you had it?
Well, I was involved in a railway collision, and both knees were severely damaged, and I was in Rachel Foster Hospital to get knee replacement, and when the usual blood tests were made, they found out that I had diabetes then.
Had you ever had any clue from being excessively thirsty or excessively tired, or was it totally...
prior to the accident it was gradually coming on, and they found they couldn't operate because of the risk of infection and with the high blood sugar level.
So they had to stabilise you then?
They had to stabilise.
And what sort of treatment did you receive at that time?
Well, I went on to various drugs, and when they found out that it was still the drugs not answering to the drugs, I had to go on insulin.
So the insulin controlled you at that stage?
Well, the insulin held me pretty well, and I was on insulin when I came down from the Central Coast to this area, and Dr. Mullen decided that there could be a possibility that a drug might replace the insulin, Varnia. So he prescribed it for me, and that was quite successful. And then he just thought that with the limited access to this drug of Varnia, that would I be prepared to give it a go with just dieting. And I did, and it held it for a while, and then he put me onto another drug which is going quite well now.
With your diabetes, have you had any other problems, for example, with your eyes?
Oh yes.
What sort of problems have you had?
Well, I've had bleeding behind the eyes and small capillaries behind the eyes that had to be treated with laser treatment. And you have to keep constant care of your feet. And your feet and your eyes are the two main factors, I found.
Okay. We know that small vessel disease is the disease that affects the eyes as well as the kidneys. Have you had any problems with your heart?
No, unfortunately I have had the operation where they go up through your vein into your heart to examine the arteries, and that was quite good. The result was quite good to that. But I've always been like great believer in that omega-3 oil. Yeah.
Were you ever a smoker?
Yes, I was for a short time, but I gave it away some 20 years ago.
Right. How long did you smoke?
Oh, I suppose for about 5 or 6 years.
Right. But you didn't have sustained smoking and you stopped over 20 years ago. So that possibly helped minimise the risk of heart problems.
Yeah, definitely.
All right. John, thank you very much for telling us your story, and I'm sure that's going to be very helpful for people getting an idea of what renal failure means in the context of diabetes.
Well, thank you, Doctor.